Hello, everyone. Today we are going to discuss OIT, writing, nursing. The patient name is Phillip Satchell. This letter is a referral letter. You can see that this is a referral letter. Yeah. Please, excuse me. Yeah, this is a referral letter, and this letter is written to a community nurse, Community Health Center, Marlborough. So you are also a community nurse. You can identify that you are also a community nurse because you can see that it's a community center, this community center, and the person, the patient, Phillip Satchell, he lives alone in public housing in Orange. So he is in Orange. It means that the community center is somewhere near Orange. Orange is the name of a place. So we have 3 places here. One is Orange, another one is Darwin, another one is Marlborough. So Orange is the place where the patient lives, Phillip Satchell lives. And Darwin is the place where his 2 sons in their 40s, they live. They don't have contact with the father. So his wife, Mrs. Satchell has died in 2007. So 4 years ago. After that, he started attending the community center. After his wife's death, he started attending the community health center. And this is the last visit is in February 2011. So this is the thing here. So we have the name is aged 73. And we have the diagnosis as a multiple sclerosis, type 2 diabetes, chronic left and right leg ulcers. So these 3 diagnoses are there. So this is not, that when this thing happened, I don't know. When this thing happened, I don't know. When this was diagnosed, I don't know. But he is under the treatment of these 3 diagnoses. So that I can identify from this particular area, and you can say multiple sclerosis. You can say multiple sclerosis is currently stable. It means that he has been under treatment for multiple sclerosis. And the condition right now is stable, but frequent relapses. He has type 2 diabetes, that he has poor compliance with oral diabetic agents and diabetic diet. It means that type 2 diabetes was diagnosed somewhere before 2011. Okay. Now chronic leg ulcers, you can say that 2 to 3 occurrences per year. So 2 to 3 occurrences per year. So this is not the first year that he is having the infection. He had the infection before. And he had pus also there. Now, right now, we are providing all this treatment. We providing multiple sclerosis treatment. Right now, his condition is stable. We are providing type 2 diabetes treatment. Right now, it is, even though he has poor compliance, right now it's okay. We are treating the chronic leg ulcers too. Now, but there is a reason why he is moving to Marlborough Community Center. So why you are writing to the community nurse in Marlborough? It is because he is moving to Marlborough for increased access for MS treatment. So he has to get better treatment for multiple sclerosis. So that is why he is moving to an equivalent housing to Marlborough from Orange. This is what we can see there. And now he has another problem, is loneliness and isolation. So the first problem, second problem, third problem, and the fourth problem. We have 4 problems. These 4 problems you have to take care of. So you are taking care of this thing right now, but we are going to hand over the care of this patient to someone else. So I have to give a brief account of these 4 things. So this is what I have identified from this area. Now, when I go with the nursing management and progress, I can see that IV antibiotics is currently in IV antibiotics and metformin for diabetes. He is having daily dressings on both his legs. Blood pressure, blood sugar levels are monitored, blood medication compliance, and provide education regarding diabetes. All these things are relevant. So what are the things that you are doing, and what you are doing the same thing they are required to do the same thing. But this IV antibiotics is now you are going to oral antibiotics. Okay, so we are switching this IV antibiotics to oral. That is only change. Rest everything, metformin, daily dressings, rest medication complaints, education, constant monitoring, everything we need to continue in that setup too. What you are continuing here, the same thing you are going to continue there. So that is the thing, that's a matter there. So we can say there is no difference in this except this IV antibiotics switching to oral antibiotics. The same nursing services that you are being providing right now, this has to be continued in Marobra. In addition, we have to say that you have to refer the patient to this diabetes clinic and a referral to a neurologist, you can say. Now, let's see how we can write this thing. This is a referral letter to the community nurse. So February 2011, so I have no dates there. So the last date, you saw it's February 2011, so I've written that date. So right now it's 2021. I cannot write today's date because that it is 10 years past, and I cannot do that. So I have written a date, right? But in actual OEG test, you'll be getting clear-cut date, or today's date will be there clearly. Community nurse, community health center, Marobra. Dear nurse, reference Mr. Phillip Satchell, age 73. Now listen, you can say the purpose of this letter is to request ongoing care to Mr. Phillip Satchell, who is now planning to move to Marobra for better access for his multiple sclerosis treatment. So that's the thing here. This letter is being written to request. I write this letter to request anything you can adopt. So I have written the purpose of this letter is to request. I can I write this letter to request. I'm writing this letter to request. This letter is being written to request, no issues. To request ongoing care. I'm going to request ongoing care to this person who is now planning to move to Marobra, to your place, for better access for his multiple sclerosis treatment. So I have mentioned only multiple sclerosis treatment because the purpose of this movement, why he is moving is for this thing. So that is the thing here. So the rest of the things we can include in the body paragraph. I cannot include everything there. Mr. Satchell has been attending our centers since March 2007. I have not mentioned since his wife death, I can say. But I don't think that we don't need to include every minute information. if possible, no, if it's your convenience, you can do that. Since his wife's death, you can say after that, it's an additional information. It is not irrelevant, it is relevant. You can say it is semi-relevant. For the treatment of multiple sclerosis, type 2 diabetes mellitus, and chronic ulcers on bottles. So the diagnoses are addressed there. His multiple sclerosis, the short form is written as we have written twice multiple sclerosis. And here too in the paragraph, we have written multiple sclerosis. And we are writing to the community health nurse, the team, the member in the medical team. So I can say, I can use this particular thing, short forms. His MS is currently stable, but he requires constant monitoring and an expert neurological consultation in Marobra. Right now, his MS is stable, but he needs constant monitoring. So you need to do that. And an expert neurological consultation when he reaches there, which you can communicate through your doctor. So which you can arrange through. So I can say which I think which you can arrange with the assistance help of, that's enough, your doctors. Yeah. So I'm not copying the thing here. It was written via your doctors. So I'm not copying that thing. So don't copy as it is. The case should not be copied as it is. Many of the students, they don't know that they accidentally copy what it is there. You need to turn these things. You need to understand the meaning of this thing and convert into meaningful sentences. So here to arrange the neurological reference with the help of doctors. That's what I have understood. So I have requested them to do that. Now, Mr. Satchell's leg ulcers are seen infected with Staphylococcus. How? What is the cause of the infection? So it is seen infected with this thing 2 to 3 times a year. Okay. So I feel this thing is okay. Here, Mr. Satchell's leg ulcers are seen infected with, or I can say are infected with, or that is better. Are seen infected is not, are infected with Staphylococcus aureus. It's clearly given there 2 to 3 times. Yeah, 2 to 3 times. Are infected with Staphylococcus aureus infections, which requires dressing twice a day. We need dressing twice a day. Apart from regular dressing, these are currently treated with IV antibiotics. These means ulcers. So we are doing, apart from regular dressing, these are currently treated with IV antibiotics. Currently treated means at present we are treating. It means at our care. It is understood that at our care, we are treating these ulcers with IV antibiotics. Apart from regular dressing, we are providing with regular dressings. Apart from that, we are providing IV antibiotics, and this will be changed to oral medications after discharge. After discharge, these medications will be changed to oral antibiotics or oral medications. So now the thing is over here. Multiple sclerosis is over. The next problem, the infection, the ulcers, multiple sclerosis, ulcers, and the third problem is the diabetes. He has been on metformin twice a day for the treatment of diabetes, but his medication compliance is poor. That is the condition. He was given education regarding management, diabetic management and diabetic, right? So what he has problems with the diabetic diet. That's why he needs education. Why we need education regarding diabetic diet? Because he had problems with diabetic, right? Why he need education for diabetic management? Because he was not going ahead with well-controlled sugar levels. So that's the thing. So he was given. So this is the condition. So it is understood that diabetic management. Why I have not given that this is to be given by you? Because I have the matter once here. Kindly refer him to Prince of Wales Diabetic Clinic for medication review and further education. So once you reach Marlborough, you have to refer him to this particular clinic for medication review and further education. And that is the reason why I have not written he has to be given these things there. I think it is clear. Mr. Satchell is a widower and feels isolation and loneliness. That is his fourth problem. So for that, he needs sincere support for connecting to community services to enhance coping and social well-being. So this is the thing here. So all his four problems are addressed. It would be appreciated if you could attend Mr. Satchell once he reaches Marlborough and provide him with the aforementioned requirements. I have mentioned requirements 1, 2, 3, and 4. Kindly refer him to this particular place for medication review and further education. If you have any further queries, contact me. Yours faithfully, community health nurse. I hope you must have understood this thing. It is just around 220 words, the body of the letter. Yes, it's 214 words within the range. Hope you all understood. Thank you.